In this video, we will discuss about some of the basic graphs that is used to identify pharmacokinetics and pharmacodynamics of the drug. So, some of the basic graphs are two main or two basic graphs for this uh, properties. In order to find out these properties of the drugs are this heat map and the spider plot. So this heat map here is plotted for like two different conditions. First one is this protein of interest degraded by greater than 80%, and then protein of interest degraded by greater than 50%. And on the x-axis it's the drug half time period, and the color indicates the dosage of the drug. So first plot on the panel A is about the daily dose or daily bolus, where we can see that as the dose amount increases, there is an increase in the half-life of this drug, indicating that drugs remains more amount of time before it is been clear out. And this is a general how a general or good pharmacokinetics drugs looks like. So it needs to have a high drug half time. At the same time, it should have a high protein degradations, and this protein of interest half time is shown on this axis. So ideal value should be like in this case 80% of this degradations half times is around this. So ideal value should be around this. So at this point we can see that the amount of dosage is uh, around less than 100 milligram, and half-life is in between these two values. Yeah, that is bit around 50 minutes or around 5 hours in this case. And similarly, if they use this weekly dosage, the value changes significantly, because here the less amount of dose will be circulated within the patient, so high clearance value should be there. And in that case also, the weekly bolus is usually used, or weekly dosage is usually used when the drugs have a very high clearance value. This is one of the examples that is shown here. And here it is weekly controlled release. So in that case, the drug is released in a controlled manner, so that it can last for longer duration time. At the same time, it will have a good efficiencies even at lower dosage. So this is how that drugs usually looks like. The bottom one is about the protein of interest with greater than 50%. So here the half-life at this point, the 50% of this protein is degraded. So here we can see that when it comes to the 50%, the values significantly increases, uh, or we can say that the the amount of drugs required to reduce this reach this protein of interest degradation by 50% is slightly high, and this is like counterintuitive, because now we need around 50% degradations, but it requires high drugs. The advantage is that it will have a less this drug half-life period, indicating that we can use the drug that does not remain that much stable. So it's like a trade-off between two conditions, whether we need the drugs that can last longer, or we can use the drug with higher dose that can last for a shorter duration time. It also depends on the patients. And similarly, here also we see the same trend, that we can use the drug at a lower amount, but its half-life period also goes down compared to the case where we are using where we check it for the protein of interest with a greater than 80% degradations. And in this case also, this we can see that amount of drugs required is increased. And another reason could be that we can use less efficient drug in that case, because here our target is to achieve 50% of the protein of interest degradations, whereas in the top row our target is to achieve 80% of the protein of interest degradations. So this is how a plot of drugs for the heat map looks like for pharmacokinetics and pharmacodynamics. Here we need to trade off and see which region gives us the best results or gives us the optimum results. And in panel B we can see that the similar thing, but in the spider plot here for the protein of interest degradation greater than 80%, the half-life period is shown on at this axis, and this drug half-life period is shown on this axis. And similarly here the clearance level is also shown for the degrader, and the DC50 and the Dmax. The degradations uh, of this degradations of the, I think DC is for the when half amount of uh, drug required for 50% in order to reach 50% of the target protein degradations. So that is shown here, and this is for the daily dose. At weekly dose we can see that the amount goes down, and for the weekly control dose the amount is more spread out. And similarly for this protein of interest at 50% we can see that it is more spread out, indicating that we can use less efficient drug whenever we have a target of achieving this 50%, just to greater than 50% degradations. And here in the same things we have seen in the weekly bolus and weekly controlled release. And one more case, or one more way by which this pattern plot can be plotted is by adding the conditions that clearance value of the degrader is less than 4.2 hour, and it is greater than 4.2 hour, which is on the left hand side, and less than 4.2 hour, which is on the right hand side. So this could be uh, crucial when we have the protein degraders that might also have some toxic effect. So I think here the clearance value is related to the this protein of interest, but here the clearance value is related to the degraders. Yeah, this is the clarifications that I want to give before I end this video. So I hope you understood the two basic graphs that are used for understanding the pharmacokinetics and pharmacodynamics of the drug, and how they are used uh, to find out the optimum conditions or the trade-off between different properties. That's all for this video. Thank you for your time.